Welcome everyone to our webinar this evening. We're so happy you could join us. The title is Say No to Diabetes Complications, Say Yes to Reducing Your Risk, Keeping Your Kidneys, Nerves, and Eyes Healthy. So we're so happy that you could join us this evening for our wonderful presentation. There is a phone number at the bottom of the screen should you have any technical difficulties. You can call Citrix support at 1-800-263-6317. Our format includes a short presentation followed by an interactive discussion. To type in a question, you can use the question section of the webinar toolbar, which appears on the right-hand side of your screen. At the end, you'll have a chance to ask questions, and so we look forward to an interactive webinar. Just a disclaimer, we know that the information you're about to hear may motivate you to make lifestyle changes. Please consult your physician before making any changes to your current routine. The Cecilia Health Certified Diabetes Care and Education Specialist will provide strategies to help manage your diabetes. This online Q&A session is intended to give general advice only. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health Certified Diabetes Care and Education Specialist. Our webinar leader this evening is Laura Eston. Laura graduated from St. Joseph College in West Hartford, Connecticut in 1982 and is a professional nutritionist and diabetes educator who specializes in diabetes self-management and medical nutrition therapy. She's committed to forming relationships with people seeking a new approach to optimal wellness through mindful awareness. She uses motivational techniques that are individualized to empower her clients to make gradual, successful, and life-enhancing changes. Laura is very active, volunteering her dietitian services in her local community and facilitates a diabetes support group through her local senior center. In her spare time, Laura can be found in the garden or on the beach, unless, of course, she's with her grandchild. Laura loves yoga, quilting, and converting her family's traditional recipes into healthier versions that are still full of flavor. So thank you so much, Laura, for being with us this evening, and you may take it away.
Thanks so much, Katie, and good evening, everyone. So our agenda this evening, our discussion will include what do we mean by microvascular complications? And most importantly, of course, how can these problems be prevented? And we'll have time for questions and answers and a little sharing even. So as a reminder, like Katie said, please talk with your healthcare provider before making any changes to your diabetes treatment plan. What are microvascular complications? This is damage to the small blood vessels in our body. It's caused by too much sugar in the bloodstream, diabetes, and or too much pressure inside the blood vessel, high blood pressure. What parts of the body are affected? So the organs with the very smallest and most delicate of blood vessels are the ones the most easily damaged. Those are the blood vessels behind the eyes, the nerves and the blood vessels of the feet, the kidneys. Diabetic eye disease is when high blood sugars can cause problems in your eyes, including blurry vision, cloudy vision, increase in eye pressure, and loss of vision. In the picture here, you can see on the left a healthy eye, on the right an eye with what is technically called diabetic retinopathy. And there are those little bulging spots there. That's what the doctor is looking for when they take that picture of your eyes. That's where the little tiny blood vessels have weakened. How do we prevent these eye problems? So the most important thing that you can do is get your dilated eye exam at least once a year. And if your vision specialist recommends, that you come back for follow-up, don't miss any of those important diabetes-related eye exams. Keep in mind that just because you don't have any changes in your vision or any issues, it doesn't mean that you don't have any changes to the blood vessels. This is something we can't feel. So your vision might not even be affected until later in the progression of eye disease. These yearly eye exams are very much a preventative to try and catch things in the very, very beginning stages before they become a problem. How can we prevent eye problems? So most importantly, keep our blood sugars under control and keep our blood pressure under control. How can we, oh, now it's being stubborn and doesn't want to move forward. There we go. So sorry about that. So diabetic nerve disease. This is where high blood sugars can cause damage to the nerves, and it causes pain, burning or tingling sensation. A lot of people describe it like pins and needles, and then a loss of sensation. It's most affected in the hands and the legs and the feet. And it is, unfortunately, our most common complication in diabetes. So in the picture here, you can see at the top is the healthy nerve with the blood vessels going around it, and the diseased nerve begins to lose its ability to transmit sensation. And at the bottom, that shriveled up nerve is when the nerve can no longer do its job and detect pain or issues and send those messages to your brain. So there's other problems for the feet and the legs as well, related to the small blood vessels. So damage to those little blood vessels reduces the blood flow, and that causes sores that won't heal, or they'll heal real slowly, dry and cracked skin, swollen or bluish feet, legs or feet that hurt during exercise, and legs that hurt or feel restless at night. So these two things together are a really dangerous combination. So you can imagine if you have damaged nerves where a person's lost the feeling in their feet and they can't feel pain or pressure or heat or cold, and then they might have a sore or a blister or another type of injury, and they might not be able to feel it. The sore could very easily become infected. The poor blood flow makes it even harder for the body to send our special cells to fight the infection. And those infections are the type that can lead to the amputation of toes, the foot, or the entire leg. Dangerous combination. How do we prevent these problems? So most importantly, check your feet every day. Get to know your feet. Every time you visit your health clinic, make sure you take your shoes and socks off to have your feet checked. This sort of triggers a reminder to your healthcare provider. Once a year, if you haven't already had it automatically, if the doctor hasn't done it, request a foot exam in which the doctor uses a tool, like you can see in this picture. It's just a little sort of a special kind of a thread. And what they're doing is they're checking the sensation and the blood circulation in your feet. How can we take care of our feet in between those doctor's appointments is even more important. So the most important things you can do on that daily foot check is check your feet for cracks, blisters, cuts, or dry skin, any sort of changes. Make sure you look between your toes and at the bottom of your feet. So you can see in the picture, the person's using a mirror because they have a hard time seeing the bottom of their feet. Most of us do. Or that you can have somebody else help you. Give them a sense of what you're looking for. And if they know your feet, they'll know if there's something different. You'll notice it. So you want to call your provider right away. If you see a sore on your foot, and this might sound like overreacting, but trust me, it's not, because infections in the feet of a person with diabetes can develop very, very quickly, and they can be so dangerous. So don't ever hesitate to call the doctor and let them know. So how can we take care of our feet? You want to wash your feet daily with mild soap and warm water. Test the water first with your wrist or your elbow and make sure it's not too hot. Dry your feet well afterwards, including between your toes, And don't soak your feet because this can actually cause your skin to be even more dry. Make sure you use lotion on the top and the bottom of your feet and any areas with dry skin. It's generally recommended, though, that you not put any lotion in between your toes, okay? And don't use any lotions that have perfume or a heavy scent or alcohol. You want to trim your toenails straight across with a nail file. Do not use nail clippers. See your doctor for the care of corns and calluses and warts. Do not try to treat these problems by yourself because an infection can occur way too easily. Many people see their podiatrist regularly to even just have them do their nail care, just to be safe. How to take care of your feet. Let's see. In the summer, those sandals can be really problematic. We want to wear comfortable shoes that fully cover and protect our feet all year round. Nowadays, they're making some really nice, you know, good supportive walking sneakers that are made of a lightweight fabric that are vented so that we'll still be able to stay cool without wearing sandals that are open and make it too easy for our feet to get cuts and sores and things. You always want to shake out your shoes and socks before you put them on to remove any small objects. And never go barefoot, even indoors. And I know this is a hard one for a lot of people. Um, but unfortunately, even when we're in our house, we can all too easily stub our toe on something or trip going down a stairs or something. So it's recommended that we always wear a covering and a supportive type of shoe, even inside. Okay. Let's see, what else can we do to prevent these foot problems? Like we said, keep those blood sugars under control. That's really key. And if you smoke, try to get help quitting smoking. That has a significant effect on the circulation, especially. Oh, and there we go again. That's the second time it gave me a hard time advancing the slide. Sorry about that delay, everyone. So, diabetic kidney disease is another one of those complications that are associated with high blood sugars and high blood pressure. Our kidneys clean the blood and they filter out waste from our blood that could make us sick if it stays in our body. And when we have high blood sugar and high blood pressure, it causes damage to these tiny little blood vessels that supply the filtering system of the kidneys. And many people with kidney disease have no idea that they have it, or they can't feel anything. They don't have any symptoms in the beginning. Their doctor may have told them that they have some kidney decline, and they're like, I don't know what that means. I can't feel anything different. But as kidney disease progresses, those waste products from our body's normal job every day, those waste products stay in the blood and they don't get removed, and it starts to cause the person to feel sick. And when the kidneys have gotten to a certain point where they can't filter the bloodstream effectively enough, and there's a whole series of declining stages, we call them, when you get to a certain stage where that filtering system is very inefficient, that's when the doctors will have conversations with people about dialysis, which is a machine that we use to filter out the waste from the blood if the kidneys are no longer able to do it. You can think of your kidneys as a colander, like what we use to drain the water from the pasta. It works by filtering out the waste, but keeping what the body needs inside the bloodstream. So when the kidneys start to get damaged, it's like the colander has some bigger holes in it, like somebody broke some of the holes and it gets leaky. And instead of the pasta, what the kidneys are allowing to slip through those holes is the proteins in our body. Proteins are really large molecules, and our body recycles them because they're really important. And so normally the kidneys keep them and send them back into the body to be used again. But if there's these holes in the kidney's filtering system, then the proteins slip through the hole and they go out the body into the urine. So when protein starts to show up in our urine, that tells us that the filtering system, that colander, is getting leaky and the kidney damage has started to occur. That's often the sign that the doctor looks at when they do that urine sample, and they might start talking to you about your kidney function. How do we prevent kidney disease? So you want to make sure you have a urine protein test every year, and it's quite possible you have it. You know, you give a urine sample and nobody tells you anything about it. You assume that all's good. You can ask your doctor, have I had a urine protein test every year, and where am I at with that? You want to try and drink 6 to 8 glasses of water a day. Make sure you're really well hydrated. If you smoke, you want to look at options and support for helping to quit smoking. Make sure you take all your medications as directed, stay active and eat healthy, but most importantly, keep those blood sugars and blood pressure under control. That is definitely the biggest and most important factors. Okay. So if you have a question, you can actually hit the question tab on your toolbar and type in whatever questions you might have. Or if you would like to share something related to any of the complications of diabetes that we've talked about that's worked for you, please feel free to share that as well. I see one question here that says, I have my, oh, so sorry, I have my volume up as high as it goes. Can it be turned up higher? Oh, I'm so sorry that, I hope that you could hear it okay. Just a point so that everyone knows, if you're not familiar with the fact that we put these presentations in the library of recordings where you registered for the live event tonight, you can watch it again. Okay, so if there were parts of it that you weren't able to hear well, please, go back in about a week or so and listen to it again, and then you'll be able to take notes too if you wanted. Any other questions? So one thing that a lot of people ask me about in coaching calls regarding complications is that they have other people that in their lives that they know who have type 2 diabetes, and or they have family members, who have a similar progression of type 2 diabetes as they've had. And these people that they know have complications that we've talked about, whether it, maybe like their aunt has kidney disease. And they'll ask me, well, does that mean I'm going to get kidney disease from my diabetes? And there is no way for us to know who is going to get what complications, or even if they're going to get those complications. This is a part of diabetes research that we're very adamantly trying to identify. And it's one of the reasons why you may have been surprised that in a diabetes presentation about complications of diabetes, we talked a lot about blood pressure, and that keeping that blood pressure under control is just as important as keeping your blood sugar under control in relation to lowering your risk of developing any of these complications. And that's the one thing that the researchers know for sure, is that people who have blood sugars that are not in good control and their blood pressure is not in good control are at the highest risk of developing these problems. I often tell people it's not good to compare ourselves to our friends and our family, because another aspect of diabetes, especially diabetes type 2, is that it is very, very different in every single person. It presents itself in different ways, and our bodies, everybody's body is different. So in one person who has the same numbers and the same A1C, they might start having some issues with their feet, the more common symptom, right? And the more common complication. They're having some numbness and tingling in their feet. And they might know somebody who says, oh, that's what my A1C is too. And that person doesn't have any issues with their feet. Now, that's just, a difficult thing to address because we have no way of knowing. Sometimes one of the things that happens is if, unfortunately, we didn't get good care earlier in our life, and maybe our diabetes was not diagnosed quickly, then that they feel is sometimes where the issues start to happen. And then we get good control of our blood sugars, but after years of the aging process, then we start developing problems. So that's probably the one thing that people ask me about the very most. Any other questions? I don't see any hands coming up or any questions. There is another thing people ask me a lot about this topic, and that is people will say, well, how do I know if I'm at high risk or if I have any of these complications of diabetes? And that's where having that conversation with your doctor who helps you manage your diabetes is really important. You want to be honest and open with them about anything and everything related to your lifestyle so that they can support you and help you make the best decisions about your diabetes self-management. And I always encourage people to make a little list of the questions you want to ask the doctor before you go in. I do it, and I'm a healthcare professional. We all get a little nervous in the doctor's office, right? So I make a little list. So you could write down this, doctor, do I have any of the complications of diabetes? And you can even list the things that we've talked to today, okay, or talked about today. I'm just looking here. I see one question about I just had my podiatry appointment today. And I'm just trying to, oh, here we go. Just had my podiatry appointment today and my feet are doing well. That's awesome. So the person who's sharing this has experienced a diabetes foot exam and got good news. That's fantastic. Let's see, I have another one. What was it that you said about protein in the urine? My audio cut out. I'm so sorry for the technical issues. So proteins appear in our urine when the filtering system of our kidneys has suffered a little bit of damage. And so the filters sort of get, I like to think of them as Swiss cheese holes, right? The holes become a little bigger and the proteins slip through the holes and they appear in our urine. So if your doctor has said to you, oh, you have some protein in your urine, so we're going to keep an eye on that, then that means that your kidneys have suffered a little stress, a little damage. And so you want to pay attention to your blood sugar control and your blood pressure control. Make sure you drink lots of water and then put that on your list of things to circle back with the doctor on your next visit and say, doc, you did another urine sample for this visit. Do I still have protein in my urine? How am I doing? And they'll let you know. Okay. Let's see if we've got some other questions here. Can I talk about how alcohol affects diabetes? So alcohol by itself, it has some very specific concerns that aren't really of this topic. The effects that alcohol has on the body and when we have a small amount of alcohol affect our blood sugar control in ways that you wouldn't really imagine. So it's recommended that a person with diabetes limit their alcohol consumption to only 2 ounces And the most important thing about alcohol consumption for a person with diabetes is what we tend to mix the alcohol with is generally a carbohydrate, or it's automatically in there, like in beer or wine. So the carbs can trigger some blood sugar challenges. The alcohol itself doesn't have a specific relationship with blood sugar control per se, but because so many people who have diabetes also have cardiac conditions, there are some serious concerns that cardiologists have about any alcohol intake at all and certain cardiac medications. So having a good conversation with your primary care doctor, and a if you see a cardiologist especially, have an honest question with them about alcohol intake. Um, but in relation to the specific complications of diabetes that we talked about tonight, um, there is not, to my knowledge, any direct correlation with alcohol intake further, contributing to these specific complications. It's really about the blood pressure and the blood sugar. So I would encourage you to have a more in-depth conversation with your doctor about that. And that was a great question. These are all great questions. I'm so glad I wasn't able to see these at first. So now I'm reading one that's kind of long. Here we are, about before and after meals. How far apart in hours, or is it in the morning after I wake up and again before I go to bed? Oh, I think this person may be referring to blood sugar monitoring before and after meals. So the guideline generally for blood sugar monitoring is there's never a bad time to check your blood sugar. If you're not feeling well, that's a good time to take your blood sugar and your blood pressure, the two of them. But generally, the times that are the most useful um, are first thing in the morning, as soon after getting out of bed as possible. So don't get up and go to the bathroom, go make the coffee, start walking around, doing a few things, uh, and then wait until like an hour or two later when you're going to make your breakfast and you sit down to have your breakfast and you check your blood sugar. Common misunderstanding, because we tend to say before meals. The fasting blood sugar in the morning, we really shouldn't say before meals, because what we really mean is as soon as you get out of bed. Okay. And then in type 2 diabetes, unless your doctor has specifically recommended that you do pre-meal blood sugars for lunch and dinner, the most helpful is 2 hours after your meal, hour and a half to 2 hours. Use a timer for this. This is the hard one to remember. That's an awesome time to check your blood sugar. And I always suggest people rotate, because we only have so many test strips. You don't want to use up too many, but do different meals and different types of meals and different days of the week even. And don't be afraid to check your blood sugar 2 hours after a really heavy meal, or a splurge meal, and see, when you have these deviations of your regular eating pattern, just how high does your blood sugar go? It's a really eye-opening process and gives you a really good sense of how your body reacts to the carbohydrate foods that you eat. And then the other really common time that we recommend checking blood sugar is right before going to bed. Especially if you check your blood sugar right before you go to bed and then you check it the following morning as soon as you wake up. That tells us a lot about what's going on in your body during the night while you're sleeping and there's no food coming in, because that period of time in the body should allow your blood sugar to return to the safe range of 80 to 130. If your lifestyle, eating habits and exercise and your medication are all working correctly together, you should be able to wake up after a night fast of sleeping and have a blood sugar in the safe range. That's the primary goal. So I hope that was helpful. Let's see, I have another one here. Oh, I think this was the beginning of James's question, and I read the end. So he had said, when should I take my reading? So I think I got all of that. Let's see, one more here. That was about the volume. All right, I think I may have gotten all the questions. Did anybody else have anything they want to add? I'm going to scroll through these just to make sure I got them all. Okay, so someone was asking about urinary tract infections, and can that be the cause of the protein in the urine? So that's a great point. Thanks so much for bringing that up, because with the protein in the urine especially, there are a lot of things that can cause protein to appear in our urine. None of them normal. Whenever there is protein in our urine, it is always something to watch out for and keep an eye on. But there are a lot of different situations where the body can spill some extra protein into the urine, particularly after we've been really sick or had an infection, that type of thing. Um, so there are other reasons that we can have protein in our urine. Um, but anytime there is protein in the urine, the doctors are usually going to check blood a little more in depth. There are 4 labs in particular that we check related to kidney function when we do a blood draw. So the doctors may do a little bit more frequent blood draw over the coming year just to keep an eye on it. I hope that helps. Any other questions or concerns? Oh, and you're welcome, James said. Thank you so much. That's the last comment I have here. I appreciate it. So unless anyone else has questions, let me check with Katie, our moderator. Doesn't look like she's got any questions that I missed. I do want to thank you all for joining us this evening for this conversation about complications of diabetes. I know this is something that people tell me all the time is their motivation for why they're paying more attention to their blood sugars and putting in that extra effort to make those difficult lifestyle changes, because they have been told they have some complications, or they see their loved ones or their friends dealing with complications, because they can be scary. The one thing I do have to tell you, I've been around for a while working with and supporting people with diabetes, and I come from a family of people who struggle with diabetes as well. So the one thing that is most important is we have so many tools today, preventative exams, the eye test, just the daily foot check alone. People who check their feet every day, by doing that, you reduce your risk of foot complications and amputations by 50%. I find that just so encouraging and motivating, so that I remember to check my feet even. So nowadays, we've come so very far. I've been a dietitian for 35 years, and actually I think more than that. And it's amazing the changes we've made. There's still so much more we need to learn about diabetes management, but our risk of complications nowadays is significantly less because of these preventative exams that we have available to us, that even 35 years ago we didn't have some of these, like the eye test. So definitely that is the most important thing, other than keeping your blood sugar and your blood pressure under control. I would have to say the third most important thing is stay on top of all of those preventative visits to the podiatrist, the vision specialist, the foot doctor, or having your doctor check your feet for you, um, and anything, talking with your doctor about your kidneys. Okay. Last chance, or last call, I should say, for typing in a question if anybody has anything else they'd like to ask. Okay, well, if there's no other questions, I'm going to remind you, like I said, there's an awesome library of events listed on the website where you registered for this event. Each time we do one of these events, we record it and we update the recording and add that to the library. And the only difference on those webinars is you don't have somebody you can type questions into. And so I would imagine probably every one of you has a health coach that you're working with. I always tell my participants that I'm coaching, if you watch a webinar that's recorded, just make a list of questions that you have and bring them up on our coaching call, and we'd be happy to go over them with you. Okay, and you have access to this awesome library of diabetes topics even after you've graduated from the health coaching program. So feel free to make use of it whenever you want to uh, learn more, sort of do a deep dive, I call them. Okay. And I thank you so very much for joining us this evening. And I hope that we'll see you on our future monthly webinars. And I hope you have a great rest of your evening and a wonderful spring. Thank you all. Bye-bye.